Sudden cardiac arrest is the leading cause of death in young athletes. Estimates vary, but some reports suggest that about 1 in 50,000 to 1 in 80,000 young athletes die of sudden cardiac death each year. To break down how rare this is and how to prevent it, Dr. Nilesh Goswami from Baylor Scott & White joins us now live. He is an interventional cardiologist, and he has been called up to speak on this issue even after Damar Hamlin's cardiac arrest last year. Good morning, Dr. Goswami.
Good morning. Thanks for having me.
Hey, let's start with laying down the groundwork. So what is the difference between cardiac arrest and a heart attack? Because I think people consistently get these two confused.
Yeah, you're absolutely correct. It's a common confusion. And so the difference is a heart attack is where the arteries that feed the heart muscle itself become compromised or blocked as a result of blockage or a blood clot. And that's an acute emergency where the heart muscle can die if we don't open the vessel. And that's the typical condition that's treated with a stent or clot-busting drugs to help break up the clot and reestablish blood flow into the heart muscle. A cardiac arrest is more of an electrical abnormality where there's some disruption in the normal rhythmic cycle of the heart, and the heartbeat becomes quite erratic. And as a result of this erratic rhythm, the output of the heart is impacted and the blood flow cannot get to vital organs such as the brain, and as a result the patient collapses. So the two are quite different. One is a plumbing issue in the case of a heart attack, the other one's more of an electrical problem. The two can occur simultaneously, so a heart attack can result in sudden cardiac death or a cardiac arrest, but cardiac arrest doesn't mean you're necessarily having a heart attack. And typically in these young athletes, so we're talking about teenagers in this case, a heart attack is obviously very rare. We see those more often in older people that are typically over the age of 35, although it's not unheard of, but a heart attack is more for older folks, whereas sudden cardiac death or a cardiac arrest can occur in any age group.
So we kind of feel like, or I think, that teens are indestructible. So when they're out there playing on sports, it kind of just mystifies me on how they can have a cardiac arrest when they're out on the field. Can you explain how that happens and if there are any conditions that can lead to sudden cardiac arrest in young children?
Sure. Yeah, there are a variety of conditions that can cause a cardiac arrest in a young patient, and a lot of these have to be genetically linked. So there's a group of conditions called cardiomyopathies. These are abnormalities of the heart muscle itself. You can get genetic conditions where the heart muscle is abnormally thick. You can get genetic conditions where the muscle is replaced by fat, and both of these conditions can result in a cardiac arrest in a young person. The other things that can cause cardiac arrests in young patients are electrical abnormalities of the heart. And so there can be genetic abnormalities that target the way the heart handles ions in flows in terms of subcellular level things that I won't get into the science of too, but essentially how the heart depolarizes electrically. And so if there's sodium or potassium disruptions in the heart, and it could predispose you to having these electrical abnormalities and rhythm abnormalities that can result in a cardiac arrest.
All right, so
finally,
we only
there
have
could be
like
some plumbing issues, as I referred to earlier.
Oh, so we only have 15 seconds left. What is the #1 thing parents should do to prevent a cardiac arrest?
Yeah, get your athlete properly screened. Go to your physician. He will obviously do a genetic and family history and do any ancillary testing such as an EKG, echo, or even a cardiac MRI if he feels concerned. But cardiac screening is the #1 thing you can do. And then secondly, learn CPR. So if you're put in that situation, you can provide the adequate care that that patient needs.
Dr. Goswami, thank you so much for joining us today.